Instead, we need to invest in the time to communicate with people at all levels, both horizontally and vertically, and to convince them of the urgency of making a commitment to an ethic of spirituality. Individually and in departments and in teams, we all can really try out and experience caring and spirituality with modest expense to the organization, as our next speaker, Linda Poindexter, actually reveals. In Linda's work as a regional wellness coordinator, she has discovered how living a work and life ethic of caring and spirituality is both a short-term and a long-term investment. Her strategies and accomplishments are applicable to any kind of organization, be it business, government, or education, anywhere in the world, since spirituality transcends geographical and cultural realities. In our increasingly multicultural workplace of the 21st century, spirituality will become the tapestry woven together by diverse people in global and multinational corporations. In conclusion, then, building healthy workplaces necessitates creating alternative forms of organizing. It requires that we construct different ways of relating to each other and offer individuals in organizations opportunities to move through these difficult transitions or ruptures in meaningful ways. As our consciousness about ourselves, about our work, about our lives changes, so too must our conceptions of health. Healthy interactions in organizations would necessarily include engaging in dialogue, embracing a concern for community, and fostering a spirituality of well-being and caring for oneself and for one's co-workers. Vision, empowerment, harmony, balance, creativity, learning, and spirituality are all words used to describe an emerging organizational culture that values a communal quest for transforming organizational dialogues, relations, and structures. More employees than ever before genuinely want to be a part of this transformation. And without a doubt, well-being in the Workforce 2000 is clearly tied to communication and to an interdependence between dialogue and spirituality. Thank you.
Thank you, Dr. Geist. Let's now begin with our first question and answer session. We will try to answer as many questions as possible. Therefore, we ask that only one question be asked per phone call, and that these questions be as brief as possible. You may call the studio directly at the phone numbers or fax which now appear on your screen. We remind you to make your phone calls at a distance from the monitor to avoid feedback. Our first call is from the Instituto Tecnológico de Acatlán from Jalisco, Mexico. Caller, your question, please.
My question is the following. How can a company... Aló, por favor. How could we start an integral health program for a company, for all the workforce, one that would be compatible with the social security programs that we have nationwide? How to have something that can integrate the social security parameters and guidelines with these new principles that you're proposing for health and well-being?
This question deals with integrating the theories and concepts you've talked about, Dr. Geist, with existing social security or governmental regulations and programs, such as health and welfare benefits, those types of items.
I think one of the ways that you can do that is has to do with having some type of incentive programs. Many companies that are utilizing the notion of well-being in the workplace see that oftentimes the amount of money that they have to pay in compensation for their health plans is a lot less, because they have people who are healthier and demanding less in terms of the health care plan. So I think that the more that you can integrate wellness into a program that provides incentives for people to be healthy, and you need to do it on a daily, monthly, yearly, annual basis. And probably Linda has a little more experience with that.
Yeah, I'd like to interject that it's my belief that when you empower people to be more responsible for their own well-being, a lot of the issues fall from the wayside, because a lot of the burden for the taxpayers will be reduced as a result of people being able to take on behavior patterns in their life that embrace a healthier way of living. And a lot of the benefits are a lot more societal than just individualistic.
Great, thank you both. Let's go to our second question, our second call. And it's from the Federación Nacional de Comerciantes from Medellín, Colombia. Caller, your question, please.
Díaz. From Fenalco, Antioch, we're calling, this is the University of Antioquia and Fenalco. We have the following question for you. How can we apply the administration, the management by values management, in order to apply in organizations these suggestions that you have?
A bit of clarification, if we may. Are we looking at a value-driven organization to help implement such a program?
How can you harmonize the values of an organization with a program like this? How can you make them compatible?
Yes, the integration of the concepts you've talked about with the values and the culture of an organization.
And, I have to come back to the concept of communication, because I think when you look at if each organization takes stock of what is important, what are the set of values that guide them in their mission and in their vision, they have to consider how it is we enact those values. Because I think a lot of times organizations spend a lot of time and money putting together in writing a vision, a set of values that they disseminate to their workers, to their employees. But when it comes right down to the process of daily communication, how it is that this is being enacted is very important. And since, as I mentioned earlier, spirituality is about the way in which we interact with each other and value that interaction, then we have to consider, is this being enacted on a day-to-day basis?
Excellent. Thank you very much. Our next call comes from the Universidad La Salle, Mexico, DF from Mexico. Caller, please, your question.
How can we combine a healthy workplace with with implementation of technologies that sometimes are personalized and customized?
Dr. Geist, can you?
Doctora Geist.
That's an excellent question. I just read this past week a study by Carnegie Mellon Institute that reported an increase in the prevalence of depression for people who work online with computers just 2 hours a week. And that says that we have a real dilemma as we increase workers in organizations working with technology of feeling alienated, not connected with other people. And so I think we do have to be careful that no matter how much we integrate technology in organizations, that we still find ways that, again, on a daily basis, people have contact, personal contact with other people, because it's impossible to enact spirituality online. I mean, not impossible, but it's very difficult. You might even have a response to that, Linda.
Oh, I think you did wonderful. That's absolutely
But from a
right
practical
on.
perspective, Ms. Poindexter, did you find that contact to be essential in the establishment of a program?
Well, when I give my presentation, I retired recently, and in my own personal life, one of the things that was so devastating to me was how am I going to deal with life after a structure for 32 years? That human contact has been so important. And so in my own personal life, definitely, I understand how important that is. I couldn't be relegated to technological isolation. It would not be healthy for me.
Thank you for that add-on. That's great. Our next question comes from the Universidad Autónoma del Estado de México, Toluca de Mexico, from Mexico. Caller, please, or the question.
How can we demonstrate to the top management the importance of spirituality if that does not really form part of the policies of the organization?
Dr. Geist.
That's one of the best questions you can ask, because I think one of the things that I've discovered in my own research and also in my consulting is that when you enter an organization, you immediately compromise some of the personal belief systems that you have. And so no matter what you do, there is that constraint on enacting what you believe as a spirituality and well-being in the organization. And that becomes even more of a dilemma when the powers that be, the decision makers, your supervisors, the people who could really make this program work are not supporting it. And I think my answer to that would really have to do with starting from where you are and trying within your circle of influence, within your own personal organizational life, to construct it. And I think to be able to focus on that, and really part of the issue here has to do with a contagion and a contagiousness that in the process, when everybody around you is engaging in this kind of behavior, I think the person who's going to be the outlier in this is the person who doesn't support it. And Linda, we were talking about this earlier, and you had a response to that.
Well, again, I also had to deal at a very basic ground level when I got into this line of work, and it was a huge issue in my own life. How do you deal with attracting people to this kind of concept? And one of the things that I found is that there is nothing more powerful than an idea whose time has come. And I believe that that's the case in the wellness. There's such a need and such a desire, and it's so appealing that it takes care of itself once you get the ball rolling.
Great. Thank you very much. We're going to move on to a call from Panama, the Universidad Tecnológica de Panama, Centro Regional Calón. Yes, caller.
What do you recommend for us to improve health, well-being, spirituality in countries that are underdeveloped or developing countries that don't believe in their human resources and they don't therefore invest in human resources? They have no understanding of that.
Excellent question. Where organizations have not fully developed human resources methodologies and protocols as we know them, but they're trying to engage in some of the concepts you've talked about, Dr. Geist.
That is a really, really important question, and it's a difficult one to answer. I find myself kind of stumped with that question because I myself don't have to experience that as frequently. But I do know that even in a country like the United States of America, where we kind of assume that human resources are valued, I think the technological push often leads this to be a problem no matter what country you're in. But I think one of the ways to do it, and again, Linda and I have had so many wonderful conversations about this, is how do you live it in your own life outside of the organization? And I think if you can begin to build that for yourself with your family so that the organization doesn't continuously impinge upon your view of your life, that you can create it in your own personal life and then hopefully, bit by bit, bring that in yourself. And hopefully you'll have a cadre of others who are doing the same. Then I think our assumption always is that it has to come from the top. And yet, oftentimes what we're finding in organizations in the United States is people are going, well, this is the theory du jour, and I'm not going to buy it. And so more often than not, I think the best way for this to happen is not to wait and expect and hope that it will come down from above, that it has to start from inside of you and work through your network of people that you work with. Have you found this true?
Absolutely. It has to be something that you have to be willing to be a living statement for what you believe in. And it takes a certain amount of courage to be bold about the things that you believe in. And the more that you talk about it, other people will hear you, and it's an energy that's felt. And so you have to start, be willing to start, make a commitment.
Well, very briefly, Ms. Poindexter, from a differential perspective, though, how did you engage the human resources component in an existing organization that was very large and make the two, the wellness, the well-being, the health, connect and be part of the overall program?
I was very lucky. The wellness program initiated at the very top of the company. So there was tremendous support for my beliefs. And even though I did encounter numerous personalities who had misgivings, were critical, the impetus, because it was supported at a higher level, gave me permission really to do a lot more. I didn't have the struggle that might be seen at a different kind of situation.
Right. You started with some things that most of us don't get to have.
I was very blessed that way.
Let's move on to our next question, if we may. And caller or question, if we could have that, please. And this is from the Universidad Autónoma de Chihuahua, Mexico.
We would like to send your greetings from the Republic of Mexico, the University of Chihuahua. And we would like to make a comment for our colleagues and friends. They were talking about the expense and how much they have to pay for the Social Security, the Mexican Social Security. We would like to give a piece of information here. The Mexican Institute of Social Security has a certain a mechanism that is also called as the House of the Insured that gives preventive medicine out freely at no cost. And they also have cultural activities for all kinds of people, not only for people who are insured. And also they also have some programs for industries, for health programs for industries. For instance, in Chihuahua, we have more than 2,200 employees who are taking advantage of these programs. Perhaps my colleagues from Mexico have not realized that this is actually available in their own cities. This is just something that we would like to make known via the forum. Thank you very much.
Thank you.
Muchísimas gracias.
And now, obviously, the recognition of available services in the social structure is critical, I would think, as a support mechanism for the things that you've talked about, and to make sure that the programs have a life and are perpetuated. Let's move on to our next question, if we may. Okay, our next question comes from the Universidad Nacional Mayor de San Marcos, Lima, in Peru. Thank you very much. Caller, question, please.
How can we demonstrate that spirituality in the workplace is actually an advantage, a competitive advantage in a company, in an enterprise organization? On the other hand, what are the financial economic variables that we need to take into account in order to study the tangible benefits that would justify a program of the sort in a state-run company, for example, like in countries in Latin America? Thank you.
That is an excellent question. Now let's start with Dr. Geist. And the questions seem to have two components. One, recognizing the value and sort of putting some scope on the value of spirituality, and then what is the advantage of integrating spirituality into an organization? Dr. Geist, let's start with you.
I think we all know that the bottom line is important to any organization, as it should be. Otherwise, organizations will continually go out of business. That has to be a consideration. And I think what I am so encouraged by is a week doesn't go by that I don't read about another study that demonstrates the value of the kinds of things that we're talking about here in terms of spirituality and well-being. As I mentioned in my talk about the value of a therapeutic massage. And I just read another interview, another study about this as well. And so over and over again, I think the evidence is mounting. Whereas before, we always saw this issue of well-being and spirituality as sort of an alternative luxury. What we're finding is that research is showing over and over that it's an integral part of our productivity, our ability to function effectively, intelligently, to work well in groups with each other. And so I think the evidence is mounting in such a way that we will have to turn our attention to it and put our money into these programs, and it will come back.
Excellent. Thank you very much. Our next call is from the Organization of American States in Washington, D.C. Welcome. May we have your question, please?
Yeah. What would be the guidelines or the structure you would suggest for prepare a group to work in wellness in an organization?
Just to clarify, the structure of the group to work in an organization, how you would construct the team to help with wellness? Well, let's take it from that perspective, from a practical standpoint, Ms. Poindexter.
First of all, it's very important that you find somebody who believes passionately in the principles of wellness. Once you have somebody who is willing to take on that responsibility, then the next is to ask for volunteers, people who actually would like to be involved, because that will make all the difference on how much enthusiasm, how much success you're going to have in reaching other people. So you need to have somebody with passion, that's primary, and then communicate that information out to everybody. And don't limit it to just management or just to one specific group. It needs to have a very broad base in order for it to be successful and effective.
Have you found that there's a need to establish members of your team that have certain technical capabilities?
More importantly than specific technical abilities is actually a desire to learn, a willingness to take some risks and get out there and be willing to come up against some maybe awkward situations where people may not be completely supportive. It takes a personality that's effective and that's respected by their peers.
Great. Something that might be subjective sometimes
yes,
is difficult to get through to folks. Our next call is from the Instituto Tecnológico de Zacatecas, from Zacatecas, Mexico. May we have your question, please? Yes, caller. Question, please.
I have learned that the concept of spirituality has been very effective in other cultures of ancient times and other times as well. What do you think were the factors that made all these things now become important again, and why were they ever eclipsed?
Okay, the value of spirituality in the past, perhaps it faded away and now it's coming back. Dr. Geist?
I think it has a lot to do with a number of things. I think, one, it has to do with the structure of organizations. In ancient times, our organizations were much flatter, and as they've become larger and the whole competitive workforce has led people to build larger, taller organizations. And I think only recently we've recognized that these structures really don't work because they distance people from one another. So you see a lot more organizations working with project teams and flattening organizations and returning to the notion that human contact is vital. I think a second component of our wandering away from this important portion of organizations is technology. As much as technology is efficient and effective It also has a distancing and barrier component to what we're doing. In fact, one of my graduate students completed a study of telecommuters, and they faced incredible dilemmas in trying to balance their public and private lives at home when the strong impulse was to work only with the technology. And it was almost like someone would have to go down the hall and get on a computer to communicate with their husband or wife because that technology was dominating what was going on. So I think the return is the recognition that as much as we can be thankful for technology, we also have to recognize its limitations and the way in which it becomes an impediment to human contact.
And as organizations flatten, the spirituality piece will become more and more important. In fact, it may be a natural outcome.
Exactly.
Good, thank you.
Exactly.
Thank you very much. Our next call is from the Universidad de Monterrey, San Pedro Garza Garcia, Nuevo León, Mexico. And the question, please.
Our question is long and also a couple that are short ones. We are quite surprised because you're using the term well-being, ethics, and spirituality. Why can't you just talk about ethics? Why do you have to add all those other terms? Because ethics, without any adornments, it precisely explains and talks about, implies well-being, in which you're talking about spirituality. My concern is that once you put all these frills and adornments, it seems like a redundant term, or that it seems like it's something that has to do with organizational culture, whereas if we talk about spirituality and well-being, should be based on justice. Now, the other question is, we would like to know if these terms of well-being and spirituality have something to do with the influence of women in public, in enterprises and organizations, and in top echelon. And we would also like to know if this ethics style maybe is less Western.
Very, very interesting question. And again, I'm going to ask Dr. Geist to start with the first component, dealing with our spirituality, well-being, and health necessary or components of ethics. So if you could address that for us, that would be great.
I think it's important to hold on to this notion of spirituality and well-being and not see it as something of an alternative or a frill. For many people, the word ethics and justice, even though I think they're an important part of spirituality, they're very abstract terms. And they're not something that someone can necessarily embrace in and of themselves. And so I think what spirituality does, it works in two ways. One, it becomes something very personal, very specific to the individual, because ethics seem far away. They don't necessarily seem concrete, in the same way with justice. And so I think one of the ways that spirituality works is to personalize this issue. And I think the other thing that it does is it asks us to think about our lives more than just an ethics in organization or justice in organization. It asks us to think about what we are concerned and care about for ourselves and the people we care about. And to bring that into the organization, I think, is much more concrete and specific to individuals than is the abstract concepts of ethics and justice. Now, I don't know if you want me to respond to the second question, or...
Let's move briefly, because we want to get at least one more call in, but let's move into the question that dealt with justice. It had to do with women in the workforce, and has their introduction in much greater numbers and sort of the management structure somehow impacted the concept of spirituality.
Okay. I think the two do go together. The caller spoke of women in the workplace, and also the notion that what we're really dealing with is a non-Western view of organizations. And I think they're right on. I would agree with them in bringing those two issues into our discussion here. One, there are more women in upper levels of organizations. There are more women making decisions about structure and policy than ever before. And I do believe that there is a feminine part of this issue that enters into what we're talking about. But I think it's more than just women. I also believe that many of the things that we're talking about in terms of health and wellness and spirituality are non-Western. And part of that non-Western view is a movement away from rationality and a recognition that our emotions and what we feel is just as important. It's an insight, it's an intuition, it's an important part of making decisions and organizing our work.
Very good, thank you. That was an excellent